Hi and Assalamualaikum everyone. Today I will be explaining about drug-food interactions, specifically the interactions between antacids and vitamin C rich foods like oranges, strawberries or supplements. So what does this mean? Basically, sometimes the food we eat can affect how a drug works in our body, either making it less effective, more effective or even causing unexpected side effects. In this case, we will look at how antacids, which are used to reduce stomach acid, can actually interfere with the absorption and stability of vitamin C, which needs an acidic environment to work properly. These interactions involve both pharmacodynamics and ADME aspects, and I'll be breaking that down in a simple way so it's easy to understand. Let's get into it. Well, let's talk a bit about antacids. Antacids are over-the-counter medicines that help relieve heartburn, acid reflux, and indigestion by neutralizing excess stomach acid. Common types include magnesium trisilicate, sodium bicarbonate, and aluminium hydroxide. They work fast and are usually taken after meals or when symptoms appear. When they seem harmless, they can interact with other nutrients and drugs, so it's important to use them wisely and follow proper timing. Meanwhile, for vitamin C is an essential nutrient found in citrus fruits like oranges, lemons, and also in supplements. It plays an important role in immunity and iron absorption. By taking these antacids and vitamin C together, can actually influence how your body absorbs drugs or nutrients. Let's look into how and why this happens. So first, what actually happens when we take both antacids and vitamin C together? When you take antacids like magnesium trisilicate or sodium bicarbonate, they neutralize the acid in your stomach, which raises the pH. Magnesium trisilicate also forms a silica coating that protects your stomach lining. Sodium bicarbonate works quickly and even raise systemic pH, not just in the stomach. Now, here's the issue. Vitamin C, or also called as ascorbic acid, needs an acidic environment to remain stable and effective. But with antacids making the stomach more alkaline, vitamin C breaks down faster, so it turns into dehydroascorbic acid, which is less bioavailable. Now, let's go through the ADME breakdown, which is absorption, distribution, metabolism, and excretion. First, absorption. Vitamin C is best absorbed in acidic pH with around 17 to 90% bioavailability. When the stomach becomes more alkaline due to antacids, vitamin C absorption drops. Sodium bicarbonate also increases systemic alkalinity, which may reduce vitamin C uptake even after it leaves the stomach. Plus, the silica coating from magnesium trisilicate can slow down or block absorption in the intestine. Secondly, for distribution, there is no major interaction here. Vitamin C distributes easily throughout body tissues, while antacids mostly act locally in the stomach, except for sodium bicarbonate, which has systemic effects. Okay, now about metabolism. Vitamin C is usually metabolized in the liver, but when the environment is too alkaline, like after taking antacids, it gets oxidized faster into dehydroascorbic acids, which is less stable and less active. This means the vitamin gets broken down before it can fully function in the body. Meanwhile, sodium bicarbonate gets converted into carbon dioxide and water, which raises both blood and urine pH. Magnesium trisilicate doesn't get metabolized much, it mostly stays in the gut and exits the body. So overall, the alkaline environment caused by these antacids speeds up vitamin C breakdown, which reduces how much your body can actually use. Now for the last one is excretion. Vitamin C is excreted through the kidneys, especially in high doses. Half-life is around 3.4 hours. Sodium bicarbonate can raise urinary pH, which may affect how fast vitamin C is excreted. Silica is also slowly excreted in urine. Now we're done with pharmacodynamics. Next, we will move on to clinical consequences. So, what can happen if someone takes both together? Firstly, the body may not absorb enough vitamin C. especially if it's coming from food or supplements taken with antacids. Secondly, vitamin C itself can interact with some medication. For example, high doses of vitamin C can increase the level of ethinyl estradiol, a component in birth control pills, and this can lead to breakthrough bleeding in some women. This interaction suggests that combining antacids and vitamin C might change drugs levels, causing them to work too much or not enough, depending on the drug. Now, let's move on to patient counseling. So, what should pharmacists or healthcare providers advise patients? First, they need to advise to separate the timing. The patient should avoid taking vitamin C-rich foods or supplements at the same times as antacids. It's best to wait at least 2 hours between them. Secondly, patients need to watch out for their symptoms. If patients experience changes like stomach discomfort, bleeding, or reduced effect of medication, they should consult their doctors or pharmacists. The patient also must be cautious with supplement they take. Let patients know that not all supplements are safe. Even natural ones like vitamin C can interact with over-the-counter medications like antacids. And last one is avoid long-term antacid use unless it is prescribed. Long-term use of antacids may lead to mineral imbalance or even gastrointestinal issues like constipation or diarrhea, depending on the type of antacid. To sum everything up, antacids are helpful for reducing stomach acid, but they also make the stomach less acidic, which is not ideal for absorbing vitamin C. So when taken together, they can reduce vitamin C's effectiveness and possibly affect other medications too. The best advice: separate the timing, know the risk, and always ask a pharmacy if unsure. So yeah, that's all for my video explanation. Hope you learned something new today. Remember this, our health isn't just about what we eat or what we take. It's also about how well we follow the advice of our doctors and pharmacists. They are here to guide us, to help us understand what's safe, what works best, and how to take things properly. Even simple things like antacids or vitamin C can have a big impact if we are not careful. So always ask when you are unsure, be open to learning, and most importantly, listen to professional advice. May we all continue to live with peace, good health, and clarity in every step of our journey. Ameen. Thank you so much for watching, and may you always be well and protected. Assalamualaikum and goodbye.